This morning in our series, The Real Skinny, bariatric surgery. It's one way for obese people to lose weight, and it is effective, but it often leaves patients with excess skin, which can be corrected with plastic surgery. Here's one story.
Breathe out, inhale, exhale, punch, punch. Good.
Attorney Stacy Posner was a prime candidate for gastric surgery. After a painful breakup, her weight ballooned to 350 pounds.
I can't look at those pictures without crying. I don't know who that person is. I was too heavy to exercise. I now was on blood pressure medication. I wasn't feeling well. My breathing was labored. I just ate and ate and ate.
Dr. Mitchell Roslin at Lenox Hill Hospital, who performed Stacy's gastric bypass, warned her she'd face extensive plastic surgery after her weight loss.
When you're 350 plus pounds and you go to 150 pounds, you're going to have stretch marks, creases, and essentially the skin is going to sag down.
Many post-bariatric surgery patients seek out body contouring to get rid of excess skin.
The analogy is blowing up a balloon and then deflating it right away. And once you lose that elasticity in the balloon, it has all kinds of wrinkles and redundancies which we hadn't been seeing before.
Dr. Robert Jetter, a leading New York plastic surgeon, has already performed several plastic surgeries on Stacy's now slender body.
Stacy's gone through the gamut of the various operations, including the lower body lift, the breast surgery, the arm surgery, and the inner thigh surgery. And she's also had several tweaking procedures or revisions.
Stacy knows her weight loss will be a lifelong struggle, but she now has the tools to hope for a bright future.
I feel like I'm the person I used to be. My mother says I have my daughter back.
Look at her now. Stacy Posner, Dr. Mitchell Roslin, and Dr. Robert Jetter are all here this morning. Good morning to the three of you.
Good morning.
Good morning.
These men really changed your life.
Unbelievably.
Tell me about how you've changed from the person you were then, besides physically, to the person you are now.
I think I had a little bit of a different journey than a lot of people that go through gastric bypass. I gained my weight later in life, and so for me, I feel like I'm more like the person I used to be.
Your real self.
And these men have given me my life back.
Wow, that's quite a reward, gentlemen, don't you think?
That's great patient.
Dr. Roslin, first of all, explain to us what she went through. What is bariatric surgery?
Bariatric surgery is surgery for weight loss. And now, as the field has really expanded, there's a variety of procedures. Stacy actually had the laparoscopic gastric bypass.
Stomach stapling, essentially, right?
Well, it's a little bit more than stomach stapling. It creates a new stomach, and then the intestines are reconstructed to try to minimize some of what's eaten being absorbed as calories. And that's one of the challenges, because they have to be on nutrient supplementation such as vitamins for the rest of their life. And people have to realize that bariatric surgery is not a cure for obesity. What it is a platform that makes reasonable decisions more possible.
And you told her that after she had the surgery, it was just the beginning. She would still face extensive plastic surgery?
Well, not only just extensive plastic surgery, but what we do is we try to make it more realistic to choose better foods,
right,
and make it more realistic to do the things that people want to do, such as exercise. And then the reward at the end of the line for many patients is plastic surgery, so that they look the same in and out of clothes.
So, Stacy, you were okay with making that commitment to change your lifestyle the way you needed to?
Yeah, for me it wasn't. I didn't give it a second thought. You can exercise 7 days a week, and you can only tone yourself to a certain degree.
That's where Dr. Jetter came in.
Yes.
When you couldn't tone yourself through exercise alone, how did you help, Doctor?
Well, Stacy came into the office and really had similar concerns to most post-bariatric patients, which was the abdominal area and the lower body area. And the excess of skin, as she gradually lost the weight, ended up, as she said, without any tone or elasticity whatsoever. So the only possible way to get rid of it was by plastic surgery.
This is serious. I mean, anyone considering this should realize that this is a serious process.
Oh, absolutely. This is a long operation. It takes about 5 hours to do a lower body lift. And the other operations that we do take even longer. So it's a serious operation. We have to make sure that patients are in their optimal medical condition. The nutritional support has to be optimal, and then they have to consider it very carefully.
In the last second, Stacy, what would you say to other people out there who are thinking, I need to lose weight, but that sounds like such an extreme and such an expensive way to go? Is there hope before getting to this point?
Yes, everyone should try to diet. There's a lot of information out there now. Everyone should try everything before actually having a surgical procedure. But once you get to a certain weight, to take that weight off, it seems virtually impossible. And I know everyone hears that it's a tool, and people say it's a tool, but I don't think they really understand what that means. And the surgery affords you to almost start fresh. And the only way to attain your goals is to totally change your lifestyle.
Well, I congratulate you on your success.
Thank you so much.
Stacy, doctors, thank you for your time this morning.